The ARTC Approach to Repairing Chronic Joint Damage by Dr. Max McLeod, D.O., N.D., Ph.D. This presentation was prepared by Dr. Max McLeod, D.O., N.D., Ph.D. Doc Max is also known as the Nutrition Ninja Doc. He's devoted over 5 decades to studying health and health optimization while being in clinical practice since 1979. What I am about to tell you should have been taught to every doctor as they went through medical school, but it wasn't. In fact, no medical school nor postgraduate training program teaches this to this day. It has taken me about 50 years to figure it out as part of my quest to find a truly effective, consistent way to restore joint function. In the vast majority of injuries leading to chronic pain, 90+%, the damage is to the connective tissue components of the joint. This damage can be due to a single traumatic event, the accumulation of damage from several traumas, or from repetitive motion activities where there was no apparent trauma at all. Of course, over time the other joint structures also begin to degenerate. Joints are held together and stabilized by ligaments. Joints are able to move due to muscles which are attached by tendons. Most injuries are the result of damage to either ligaments, tendons, or both. When ligaments are damaged or sprained, they do not heal back to full strength. Anyone that has ever sprained an ankle can attest to that. They heal back to only about 50-75% of their original strength and a bit longer than they were before the injury. In the case of tendons, they are also weakened, especially where they connect to the bone. Why don't tendon and ligament injuries heal back as good as new? They have a very slow rate of cellular turnover or replication. Different cell types have different replication rates. Intestinal cells turn over or replicate every 2 to 3 days. Skin cells take 30 days. Red blood cells every 90,120 days. Nerve cells can take months. Scientists have not been able to confirm what the turnover or replication rate is for tendons and ligaments because they are so slow. There is speculation that in the case of ligaments, it might be decades if they replicate at all. That's why they need the stimulation and support that we'll talk about later. The bottom line is that post-injury, weakened tendons and ligaments lead to a certain amount of joint instability relative to what it had been prior to the injury. The nerve sensors in the joint send messages to the brain about the looser, less stable situation, and the brain does the only thing it can to help compensate and stabilize the joint by sending messages to the muscles associated with that joint to tighten up. This messaging is 24 hours a day, 7 days a week. This leads to chronic muscle tension and restricts blood flow, leading to reduced nutrient delivery, including oxygen. This eventually causes damage to the mitochondria inside the muscle cells, leading to reduced energy production, increased lactic acid production, inappropriate inflammation, restricted movement, and pain. Additionally, neuromuscular trigger points will tend to form which can lead to additional muscle tension and pain in areas not directly involved with the primary injury. Over time, all of this leads to joint damage and breakdown, including calcium deposits and bone spurs, arthritis. What does modern medicine do about this? Not much, and what they do actually causes more harm over time. They recommend things like anti-inflammatory medications, pain medications, rest, ice, heat, and physical therapy. As it progresses, depending on the joint, they will offer cortisone injections, gel injections, nerve ablation, and surgery. Eventually, they will recommend joint reconstructive surgery or joint replacement. Overall, none of these things addresses the root cause of the problem, the damage to ligaments, tendons, and their attachments. Is it any wonder that those approaches do not work? Is it any wonder that those approaches actually speed up the degenerative process? If you weren't aware of that, you should be. What do chiropractors do about this? Chiropractors are primarily focused on the spine, although some do treat the extremities as well. Their primary tool is called HVLA, which stands for High Velocity Low Amplitude Adjustments. Their goal is to put the joint back into proper alignment to restore proper nerve flow so the body can heal itself. While the philosophy of assisting the body to heal itself is quite valid, simply putting the joint back in proper alignment will not restore ligament or tendon integrity. The very fact that the bones continue to go out of place is confirmation that the ligaments are damaged. How about physical therapy, massage therapy, and acupuncture? Physical therapy is focused on a variety of basic exercises designed primarily to strengthen or stretch the muscles of the joint. Massage therapy is focused on working the muscles, which typically provides some temporary relief. However, since it also fails to repair the ligament and tendon attachments, the benefits are quite short-lived. Acupuncture is focused on opening up blocked energy flow through the body, thereby helping the body to heal itself. Another focus or goal of acupuncture involves the toning down and modulation of pain pathways. None of those approaches can repair damaged tendon and ligament attachments. Our solution involves correcting the underlying root cause of most chronic joint pain. We use a blend of the most proven and cutting-edge techniques to help restore proper integrity and stability to the joint, the associated muscles, and the damaged connective tissues, ligaments, and tendons. Some of those techniques include joint decompression, shockwave therapy, red and near-infrared light therapy, electrofrequency therapy, trigenics muscle-brain reeducation, and regenerative injection therapies. Additionally, we place a strong focus on proper nutrition, restoring, and resetting the microcirculation. The microcirculation is the only place that nutrient exchange takes place between the blood and the trillions of cells of the body. Several of the approaches we use play roles in supporting proper blood flow and nutrient exchange to the damaged tissues. Each person's injury, pain, and situation are unique, so there are different therapies and components depending on your particular situation. It is important to have a consultation and examination to be properly evaluated so we can determine how we can best help your body to heal. We will design a program to help restore the damaged joint complex to get you out of pain and back in the game. Some additional background on how I figured all of this out. I was an accident-prone kid that had quite a few significant injuries. Of course, most of them came from doing stupid things like doing flips off of park benches and landing on my head while severely spraining my neck several times, or picking up the light end of Volkswagen Beetles just because I could. The point is that I had some chronic joint injuries from a young age which meant pretty constant pain. I spent over 15 years researching and trying everything I could find to fix myself. When I decided to go back to study osteopathic medicine after practicing as a naturopathic physician for 15 years, I learned about regenerative injection therapy. I found an old doctor, who was one of my professors, that knew how to do it and coerced him to teach me and 2 fellow students how to do it. Then we went to a weekend conference to learn more. After that, we started treating each other's injuries. After my 4th session, I felt like I had a new back. That started me on my obsession with this amazing technique. I've done thousands of cases over the years, more than 95% of doctors trained in this technique. Along the way, I learned from every patient and gradually figured out the rest of the details shared here. That is the end of part 1 of this presentation. For more details about regenerative injection therapy and our approach to repairing chronic joint damage, please go to part 2. FYI, we also provide a variety of age reversal, performance and appearance enhancement programs. Contact us at 941,806-5511 to learn more. ARTC Health. We invite you to learn more about our innovative approaches to helping you optimize your health. Check out our website at ARTC Health, subscribe to our newsletter to receive future updates, or call us to schedule a consultation. ARTC Health, 941-806-5511. doc@artc.health. We invite you to learn more about our innovative approaches to helping you optimize your health. Check out our website at ARTC Health, subscribe to our newsletter to receive future updates, or call us to schedule a consultation. ARTC Health, 941,806-5511. doc@artc.health.